During my journey through the subject of ENT as a student, the problems that I encountered during my term, during the exams, I've tried to solve over here. This cassette would include X-rays, instruments, and specimens. To begin with, the X-rays. Amongst the X-rays dealt with in ENT, the most commonly seen, or for the matter of fact, the most commonly advised X-ray is X-ray of the paranasal sinuses. The paranasal sinuses, as you know, are having different anatomical locations, which means one single X-ray film cannot depict each of these sinuses clearly. To begin with, we would begin with the Calvel's view or the occipitofrontal view as you know it. The Calvel's view is taken in such a manner that the cassette is situated in front of the patient's face. The beam of light coming from behind the cassette in front of the patient's face so that maximum exposure is given to the frontal sinuses and the other paranasal sinuses. Now this is different from an X-ray skull, as in an X-ray skull the rays come from front and the cassette is kept behind the skull. Therefore, maximum exposure we get to the frontal sinuses in this occipitofrontal view, also known as Calvel's view. Now we see few plates of the Calvel's view. The first X-ray film of the occipitofrontal or Calvel's view shows the various structures: the frontal sinuses on either side, the nasal septum in the center, the ethmoid sinuses, and the nasal turbinates. The maxillary sinus is not commented on the frontal view because the petrous apex of the temporal bone, as you see on either side, covers the maxillary sinus. Normally the frontal sinuses are paired sinuses, however the anatomical size has no relation to the pathology. The size of the sinuses may be different and they are never ever paired as the size is concerned. Normally, as you see over here, the frontal sinuses show an intercellular septae. This gives it a clove-like appearance, which is also known as a scalloping appearance. This means that each frontal sinus is composed of a number of air cells which constitutes one frontal sinus. The next plate of a Calvel's view shows us the frontal sinuses, which are much larger than the previous one which we had seen. These are known as a hyperneumatic or a very large frontal sinus. Hyperneumatic sinuses are commonly seen in patients of acromegaly. Here in the right frontal sinus we see a radio-opaque shadow, and this radio-opaque shadow is an ivory osteoma. Because the density of the shadow is much more than the density of a bone, so it's a bony tumor. So this X-ray is labeled as an osteoma of the right frontal sinus. What we should do in this case is remove a X-ray lateral skull, because in a Calvel's view no idea is obtained on how big the osteoma is. The intracranial extension or the external extension of an osteoma is only seen by a lateral skull, which would determine what the treatment should be. If the osteoma is extending intracranially, it is removed by the neurosurgical approach, and if it is extending externally, by a plastic surgery approach for cosmetic reasons. As we've seen in the previous X-rays, the petrous apex of the temporal bone comes in the way of the maxillary sinuses, and because of this reason we cannot comment on the condition of the maxillary sinus in Calvel's view. So modification of this is known as Waters view, also known as occipitomental view. Here the patient's head is tilted in such a manner that the petrous apex now falls below the maxillary sinus, thus clearing all the obstacles in front of it. And in this view we can clearly see the maxillary sinus, and any disease is detected at its earliest. The view taken is similar to the Calvel's view, but for the patient's head is given a tilt for 45 degrees so that the petrous apex comes below the maxillary sinus and the X-ray beam comes from behind to the X-ray plate, which is facing the nose and chin in front. This is paranasal sinus Waters view, classically seen for the maxillary sinus. The various structures seen on a paranasal sinus Waters view, also known as an occipito-mental view, are the frontal sinuses which are projected obliquely, the maxillary sinus, the nasal septum, the odontoid process, the foramen magnum, the mentum, and just above it, through an open mouth, the sphenoid sinus. Now, the left maxillary sinus in this first plate shows a radiolucent shadow, and this indicates that it is a normal maxillary sinus. To label a maxillary sinus pathological, the shadow has to be more dense as compared to that of the orbit. Now on the right side, here we see a radiopaque shadow which is having an air fluid level in the right sinus. This means that the patient has right maxillary sinusitis with an air fluid level. The method by which we confirm that this is an air fluid level is by repeating the X-ray in the lying down position. On the lying down position, the air fluid level disappears and it becomes a complete haziness or a complete radio opacity is seen in the maxillary sinus. However, the other second differential diagnosis that one would give with the opacity would be a polyp. But with the fluid level, as you see, the central point is at a lower level as compared to the peripheral point. This means that there is a concavity which points upwards, which indicates that this is an air fluid level and indicates right maxillary sinusitis. Similarly, in the next X-ray plate, we see on the left side an air fluid level with concavity pointing upwards, so this indicates left maxillary sinusitis with a fluid level. The third plate, again a Waters view, shows complete haziness of both the maxillary sinuses. Here the haziness is much more as compared to the orbit. So the orbit acts as a guideline or as a reference to the pathology of the maxillary sinuses, and here the walls of the maxillary sinus being intact indicate that this is chronic maxillary sinusitis. On the same X-ray lower down we see the odontoid process, the mentum. Now to note whether the extension given to the patient's head is adequate or not, this acts as a guideline that the odontoid process should lie below the mentum. If it does not lie below the mentum, the petrous apex of the temporal bone would obscure the view of the maxillary sinus and would give us a false clue that the patient suffers from maxillary sinusitis. Again over here, we see haziness of the maxillary sinus on the right side, but just note that the lateral wall of the maxillary sinus is destroyed. As compared to the left side, you can clearly see the lateral wall, while on the right side, the lateral wall has been eroded, and this is suggestive of malignancy of the right maxillary sinus. The next plate shows the patient having an open mouth, a radiolucent shadow, which is a sphenoid sinus, and in the maxillary sinus, we have a small opening which is marked by an arrow. I think you may be able to see it. It's the infraorbital foramen. On the right maxillary sinus, we see two radiopaque shadows with convexity pointing upwards, meaning the central point is highest as compared to the periphery, exactly unlike a fluid level. So this is a right-sided, bilateral or a multiple maxillary polyp. And in the last X-ray down over here, we see a maxillary polyp classically showing a convexity pointing upwards in the right maxillary sinus. So this is a right maxillary polyp.